Good afternoon, welcome back. This is Saima if you haven't met me before. In today's video, I'm going to talk about the nurses and how they can protect their license. Here in the UK, when we are new in the country, we don't know much about the rules and regulation. We don't know much about the NMC codes, and we can make these silly mistakes, all right? So if you are interested in this video, please watch the video till the end. And if you like it, you can also give it a thumbs up and subscribe to my channel, right? So let's dive into the video without any further delay. So when I was new in the country, after getting my NMC pin, I was very alert and oriented all the time, like conscious what I'm doing about the medications. If I was giving any medications or doing any personal care or anything like that, we need to be alert and vigilant all the time. But yeah, so when you are new in the country, you pay it more attention, isn't it? So one thing I want to tell you about is the breaching the confidentiality of the patient. Okay, so there was a case recently about Zoe. You must have heard about it. So this lady accessed the patient record, right? So if you are not looking after a patient, you have no right to see the patient records. You have no right to see the patient reports, patient diagnosis, treatment, or what is happening to the patient. Okay, if you are providing direct care to the patient, if that patient is in your department, if you are directly looking after that patient, then only you can access the patient record, right? If it's someone, your relative, your friend, your neighbor, or you know them, like far family friends or anybody in your area, they wanted you to check on their behalf. Okay, someone says to me, Saima, I know you work in the hospital. I was just waiting for my blood test reports, but I didn't get any response from the doctors. Can you please check? And maybe that lady is my friend. I'll be like, yeah, sure. No, you cannot do that. It's a big no. You will be putting yourself in trouble. So you can directly tell to the person, I'm so sorry, but I can't do that. You need to call your GP or your doctor to get the results, right? And if you do that, okay, you may lose your pin, your NMC pin. A lot of nurses been struck off from the NMC register because of this reason, because sometimes we don't know, right? You are on the computer and someone asks you, oh, can you check my report? Or maybe your colleague will ask you, or yesterday I was at the GP, or yesterday I came to the hospital, do you mind checking my reports? It can put you in trouble, right? And you may lose your pin. So if you lose your pin, you won't be able to get any job in the UK, and they will have your record for forever, right? So whenever even if you want to apply, you won't be able to get the job because your license will be revoked, or you will be struck off from the NMC register. So this is very complicated. This can be very complicated. Breaching the confidentiality, it can be like seeing the patient record, it can be seeing the patient reports if they are not under your care, if can be sharing the information about the patient as well. Okay, if you know the patient, but the relatives or someone over the phone, they called you, oh, can you check on my mom and tell me what is happening? And then you see in your system, yeah, this patient is here, and then they are saying that they are the family, so I can tell them about what the patient is doing or how is the patient's health, without checking who is the next of kin. So you need to make sure that you are giving the information to the right person. You can only disclose the information about the patient or about the relative, about the treatment, or about any reports to the next of kin, who is the next of kin on the system, or who has the power of attorney. So if they are the next of kin on the system, then only you can tell them, yeah, okay, so are you the next of kin? Yes. So if they say yes, okay, you check in the system if it is right what they are saying. You check the name. Usually we have the name and the phone number of the next of kin in your system or on the patient medical record. right? When you check, okay, this patient, this is the next of kin, and they are saying they want to know about the patient condition, so then you go on and follow the procedure. But if someone was calling and you told them about the patient condition and they were not the next of kin, it can also put you in trouble. It's also breach of the confidentiality, and it's not right for you, right? And also sometimes people on the phone, they can lie as well. Like sometimes they may be neighbor, but they know that the son is the next of kin. For example, the neighbor is calling on the phone and saying, I'm the next of kin, my name is this. So how you can make sure that you're talking to the right person, right? So you can ask about the patient's full name, you can ask about the date of birth, or you can ask like any security question, just to, if you feel like, if you doubt it that it is a different person. And also they might be a bit hesitant as well. If there is any other there is one more problem, that sometimes people we treat patients for their best interest, and sometimes they have passwords also. So if someone is calling and they want to speak to the patient, or they want to get some information about the patient, you can also ask them about the password. Okay, if one of the next of kin, if the next of kin doesn't want you to give any information to the other family member or other patients or other relatives, they may organize a password. They may say, okay, please give us only please give the information only to us about the patient, and we will set up a password. Okay, so when they call and you ask them what is the password, if they tell you the password, you can disclose the information. But if they don't, you are not allowed to tell any information. This is very serious, guys. Okay, when we were back home, when I was back home, I didn't know about this one, that one daughter wants to know the information about the mom, and that's the daughter who has the power of attorney, or who is the next of kin, and that next of kin doesn't want the other daughter to know to know anything about the mom. So it can be a bit complicated. Like, they're the same family members, they are from the same family, is her mom, and the other daughter is also the daughter of the mom. So you'll be thinking, oh, it's the daughter, they'll be like, I'm the daughter, I'm her daughter, so I should be the next of kin. But everybody is not the next of kin, bear in mind. Okay, and you need to be very, very careful about it. The rules are very strict. So if you are not sure about breaching the confidentiality of the patient, read through your patient's note. Okay, every time you go to the shift, read through medical notes of the patient. Check if there is any safeguarding concerns. Check if there is any password protected, if the patient is password protected, or if they need to if the next of kin is one person, or there are multiple family members. If there is a safeguarding concern, obviously there will be some problem. Safeguarding could be against the family members, could be about the nursing home, could be about the home situation. So anything, if they are having any safeguarding concerns, be mindful of what the safeguarding is about and who is it against, and whether they can visit the patient or not. If it's against the husband, or if it's against the son or the daughter, or are they allowed to visit the patient? What if you don't know, someone came in on the door and they'll be like, this is my mom, can I see her? And then you didn't check the notes, and you'll be like, yeah, sure, your mom is here, you can see her. And there was a safeguarding against that person. So that person came in, mom didn't want to see her, and she's here. So it'll be a big trouble for you guys. Yeah, it's so much deep in, right? When you are sitting in your country back home, you wouldn't know about these ones. So I thought I will share with you guys. It is very important that you don't breach the confidentiality of the patient. Okay, keep the patient's privacy, and it is that's how you are going to protect your NMC pin. So I was reading about that one, about Zoe's case, and then she used to read the patient medical notes, patient reports, like 3 or 4 times she did it, and her name was taken off from the NMC register. She can never practice nursing again in the UK. So if you are someone, you wanted to check the reports of your husband or any of your relative or your family member, and you went online and you saw the reports, you will be in trouble. Don't ever do it. If you have any doubt, you can call your GP. If you are not if you don't want to call the GP, there is NHS app as well. You can access your reports, you can access your records, your prescription, everything you can see. If that is not enough, you can also request your notes, your medical diagnosis and everything from the hospital. If you want to see from the NHS, you can also request it through online. You can call them and ask about it. Okay, so that's all. This is all for this video. If this topic was if you didn't know about this information, let me know in the comment section. And if you want to know anything else about working here in the UK, let me know. I'll be happy to post a video for you. Take care. Thank you. Bye bye.